Yeah, my name is Heun, and I'm a consultant psychiatrist, and I want to tell you something about the multidisciplinary assessment in old age psychiatry. Yeah, it's not easy to deal with elderly people because sometimes when they're demented, you can't get all the information you need. So you have to ask other people, and sometimes when you are just with a patient, you can't just know what they know and what they don't know. And so the multidisciplinary assessment is necessary. And the reason for that is that you have physical, psychological, social problems, and sometimes spiritual problems. And that for that reason, you need something, the support of others for the assessment, for the management, and possibly also for the follow-up if need be. And you require lots of collaboration between health and sometimes social care, sometimes voluntary organizations who deal with dementia, or you sometimes have to deal with the family who can be supportive more or less. Okay, so the assessment includes a full history from the patients, from the carers, from the relatives, full physical and neurological examination. You have to know how patients can see, how they can hear, and how they can think. So you need a full mental state examination, assessing their mood, whether they have depression, but also their cognition, which is something you wouldn't need in a younger person. With a cognition, you very often need a mini mental state examination, or you can use another tool, which is usually very often in Britain used is the Addenbrooke medical or cognitive assessment. Right, so you need a social assessment. Sometimes what are the needs? Can a patient with dementia live on their own? Can they manage money? Can they manage their legal problems? Can they still drive? Do they know that they can't still drive? So we had sometimes patients coming to the clinic, and sadly, the patients came in, had very poor cognition, and the wife was sitting for more or less 50 years as a passenger, and she was more or less happy with that. But when you ask the patient what would happen if there was a ball coming on the street, would they expect another child running after that? And some of these understandings are very little sometimes. So sometimes it's also important to assess the carer's need. Can they manage? Very often patients are assessed into or admitted to a mental health psychiatric unit simply because the carers can't go or manage with the aggression of the patient, or they can't manage the physical health needs. So usually the best place to assess a patient would be in a patient's home. And usually patients feel more comfortable in their home. You can see what they need. There's no point saying, they can't travel to Paris, because that's not the usual need. But the question is, can they manage their food? Can they manage a microwave? So you can assess the living conditions, the social options, social activities. Do they manage their medications? Do they need blister packs, or can they manage their own medication by taking out of larger units? So it usually makes sense to have family members, neighbors, and other people available for the interview, which can be quite tricky sometimes because there's confidentiality. So very often you can't talk and tell people from family what you think is happening, or you can't tell the stories the patient has told you or his worries. The patient might have been paranoid about the neighbor, but it's not up to you to tell that. However, it's also much easier if you really have information from neighbors, relatives, and family. Right. So then the question is there already a home treatment team involved? Have been support by others? Very often, if people are admitted to hospital, social care support has been falling down and hasn't been managed. So I think in all of this process, you need doctors, nurses, Sometimes you need an occupational therapist who can see a patient at home or in the hospital, whether they can manage their food and their drinks. And sometimes you need support of a social psychologist if long-term conflicts are a problem. Legal professionals might be necessary. Right, but with all this multidisciplinary assessment, you shouldn't forget that we are very often in front of patients, and it's very important to see what the patient is telling, what's his story. And the other thing is not just what's his story, but it's also how he tells a story. Is he getting very repetitive? Is the story very general? Is it very specific? Can he remember details? Can he remember details of recent evidence, or is it just remembering old-time stories? So that's very important to assess the patient, and it can be very difficult sometimes because patients don't want to be helped, and they sometimes see you as an intruder. They might not understand what the whole assessment and the whole drama is all about. Right, okay, so then financial issues have to be assessed, medical problems. You need to know about the alcohol history. You need to know about what family support is available, what activities of daily living need to be done and can be done, and what other activities of daily living might not be necessary anymore. It's very common that if people are in the middle stages of dementia, that they can still eat some sandwiches or finger food, and they're quite happy with that. And but they struggle with the cooker, and it can be very difficult. And so sometimes the housing association will be asked to switch off the cooker, and people can use the microwave. And you try the occupational therapist then has to find out how that works. Sometimes we have physiotherapists to go out and see whether a patient can get up to the stairs into his room. Can he manage a key? Can he get in? So for all of this, you also have to check whether there are hearing problems, problems with vision, is there anxiety, is there mood disorders, is there cognitive impairment? And so I just mentioned cognitive impairment. It's about memory, it's about orientation. Do people know the dates? Do they know which year are they in? Do they know where they are? Usually it's that the temporal orientation is lost before the spatial orientation. So, and sometimes you have to get from the family the information whether there's a history of cognitive impairment. We have a patient who has lots of anxiety, physical health problems, and she had an accident before, a severe car accident, which already made some impact on her mental functioning. But that wasn't then not the problem. So the question is, sometimes you have problems with patients who are long-standing and who might not be addressable, but other things which are maybe just more recent can be treated with. I mentioned the Addenbrook's cognitive examination. That's freely available. It has different domains, and for people with dementia, memory and verbal fluency is the most important. Language, attention, and other visual-spatial abilities like counting, they still are functional. And there are plenty of scales, available. You choose what you like. So the other thing is, you have to focus on carers sometimes. It's very important to see what is their relationship with the patient. We have lots of people who are nieces and nephews, and they can be very much involved and very supportive, or they can be quite distant. So what is the care they already provide, or they think it's needed? What is the stress or distress under which the patient is and under which they are? What help would they want? What help would they need? And sometimes what help would they expect or accept? So we have patients where the wife has been married for 50+ years, and she would never give her husband into a nursing home. However, it's a really struggle if an older woman who is in her 80s wants to care for an 85-year patient who soils themselves, and then even the carers coming in for a couple of hours during the day, that's possibly not helping. But that's sometimes a very difficult balance that family doesn't have a real understanding of what is manageable and what is not. So the question is, what is the understanding of the patient as well as the relatives of the illness? Is it dementia, depression, delirium? You have to have realistic expectations, and sometimes can be quite difficult to get people to understand what you can deliver, and what's available in formal or informal settings. And the other thing, what you also need for your multidisciplinary assessment is who has power of attorney. Is it necessary to have power of attorney? And that might be another day. Thanks for listening. I hope it helps a little bit. If you want to subscribe to this channel, which provides lots of hopefully useful information, please do so. Thanks a lot for your interest. Bye-bye.